Did we do this?
We did it.
Oh my goodness. I'm so excited. I always am nervous with technology. It's like, is it going to work? Is it not going to work? Anyway, well, I'm excited to be here today. Are you excited?
Excited. I'm excited
Okay.
about what we have plans to talk about. I'm excited.
Okay, amazing. All right. Well, let's get going. I think everything is like good to go here. So I guess we could start with introductions. I can start. So I'm Dr. Kristin Bendikson for people who don't know me. You probably know me, maybe not. I don't know. I am one of the fertility specialists here at Pinnacle Fertility, California. Some people have known us for a long time as California Fertility Partners, and we recently switched our name, but otherwise. Right now, we're all the same except for this big news about our insurance, which is really amazing. And I started here last year. I'm so excited. I have known this team and in this practice for such a really long time. So for me, it's like coming home, not going to a new place. So I have been so incredibly welcomed here. I feel very blessed to be taking care of my patients here. So it's wonderful. And tell everybody how fabulous you are and what you do at Pinnacle.
Thanks so
Mhm.
much. I am the Senior Director of RCM and Payer Strategy here at Pinnacle. I joined Pinnacle last year as well, 2025. They brought on some great people. But I have my time here fully. Great team, great people to work with, great doctors. Everything has been really, really smooth and going well. I'm happy to be on this call with you and kind of
Yeah,
share background on the insurance side, but doing
sure. So tell everybody what RCM means. So I know what RCM means, but I don't know if everybody else knows what RCM means.
right. RCM is revenue cycle management, so it houses all the fun stuff with insurance benefits and insurance payers and prior authorizations, all that fun stuff.
Okay, amazing. Well, the reason we have you on here is that you are an expert in insurance with everything that you do. And as most people know, we have a new insurance bill that was passed such a long time ago at this point, but it got finally got implemented, ready to go January 1 of this year. And so we just wanted to talk today a little bit about what this insurance bill means for people. Who does it impact? Who doesn't have coverage? Because there is some fertility coverage that we'll talk about, and kind of what people need to know about it and what they need to do to figure out if they do have coverage or not and how it impacts them.
Yeah, excited to go through it
I
and
know.
and also learn some stuff from you too.
I know. Well, we can start a little bit about the different phases of fertility treatment, and then that will start making sense when we start talking about what is covered and not covered. Um, so, generally, when you are dealing with either a fertility issue, you're not getting pregnant, or you've had multiple miscarriages, or just incidentally, your OBGYN is telling you that you have a syndrome or a disease or a disorder that might impact your future fertility, or you randomly find out you have a genetic disease and common with your partner, or if you are LGBTQ and you might need assistance, or you're a single parent by choice. There's so many different things that might lead you to need to speak with someone like me, which is a fertility specialist. And so usually the starting point is that first fertility appointment, and we'll kind of talk about that and how kind of learning about your insurance, how that gets involved. And then once you meet with your fertility specialist, we have to decide what are the necessary diagnostic tests that we need to do to help kind of help figure out, one, what is really the best path for you as a patient, and kind of what you want to do. Some of that is dependent on kind of your overall your goals for family building. So we spend a lot of time talking about that. And then you'll go into the diagnostic testing phase. So you have either ultrasound, sometimes there are tests to look at the uterus and the tubes and the sperm. So there's all sorts of things that might go on. There might be some counseling involved, depending on the situation. And then usually what will happen is we'll kind of, once those things are done and we have a better understanding of where we are, we can kind of make a decision on like what is the most appropriate treatment, and also what as a patient you feel comfortable with, because those are two different things, right? So I might make a recommendation of like, hey, I think we should start here, but we could start here, but my preference is to start here for you. That's what I would recommend. But as a patient, you should have this agency. You should find a physician that will give you agency in your decisions to say, you know what, I understand why you're recommending this. We'd like to start here. So there's different levels of fertility treatment. So there is fertility preservation, where women are getting stimulated to like grow eggs, and then we take those eggs out in a very simple procedure and we freeze them for the future. There's times where people are creating embryos to save for the future. So they either are doing that with a partner. If they don't have a partner, they might be getting sperm. It's like a sperm donor, right? It's someone they don't know. Sometimes a sperm donor is someone you know, but it's not your partner per se. And then there are times that people need assistance in getting pregnant. So they might be doing something a little bit not as aggressive. That would be considered like an intrauterine insemination or an IUI. There are other treatments that are IVF. So IVF is kind of this. The first part of IVF is the same as egg freezing and embryo freezing, right? We're stimulating the eggs and taking them out. In IVF, our goal is to like put the sperm and the eggs together to make an embryo, instead of like embryo banking, where we're banking embryos for the future. Usually with IVF, your goal is like your goal might be to bank some eggs or some embryos for the future, but your goal is as soon as you're ready and have enough embryos that you feel comfortable with, then at that point you would move in right away to transferring an embryo back in and getting pregnant. So those are kind of all of the big things. Sometimes we have to weave surgery in there because we might find something that needs to be fixed. So there's kind of other things that can jot in there as we need, but those are kind of like the big picture fertility treatments. Sometimes those fertility treatments require like a donor egg or a surrogate. Sometimes, for example, with like a same-sex female couple, we're doing reciprocal IVF. So they're both creating embryos and they're going to carry each other embryos. So there's lots of different complexities in terms of like what we might decide. But all of those, I think, are important to understand in the context of like, okay, how is insurance impacting me as I'm going through this journey? And it's really important where we think about having this insurance, because some of these fertility treatments can be really quite expensive. All right. And so to have access and to have an insurance that will cover these treatments, this is going to allow some people who might not otherwise be able to afford IVF or afford multiple cycles of IVF, because IVF, it doesn't work all the time on the first time. So sometimes you actually have to go through that process a couple of times where you're making the eggs and making embryos, especially if you're thinking about having, your entire family, right? And so, it is important that this insurance it can broaden the aperture and allow more people to access care. And that's so critical. That is really what I'm so happy about when it comes to this bill.
Yeah, absolutely. And you kind of just hit it spot, right? This just opens up access for those people who want to grow their families, and either that or learn more about maybe future plans and things like that. So
Absolutely. Absolutely. I mean, I just think that if people understand that they have fertility coverage, I hope it actually helps people get to a fertility specialist sooner. right? Because there are a lot of people that I see that have been struggling for 2 years. And, we have some really good data that suggests that, like, if you are, if you're under 35, you can try for a year, but that doesn't mean that you should be trying for a year. You might have an issue that, like, I might be able to see in an ultrasound that says, wow, you have endometriosis, you have PCOS. We need to be intervening sooner. So the sooner that someone comes and talks to me, the better. And certainly as women get older, there is an age component to our eggs. And so at 35, we never want anyone waiting more than 6 months. So if this insurance helps people get in sooner, I'm all for that.
Uh,
So can you talk a little bit about the mandate? And because it doesn't cover everything. So can you walk us through a little bit of, like, what the law kind of says that we need to do, or what the insurance plans have to do?
Yeah, absolutely. So what this mandate covers, and it started on January 1st, 2026, so it's still newer. But again, we've been living this for a while. So it started January 2026, and it covers like the fertility diagnostic workup and treatment, and then it will cover medications along with some other fertility services. There's a certain there's certain things that are covered, and we can go through that here in just a second. But it
Hmm.
does do health insurance plans that have over 100 employees, and that are California based. So there are some little rules around this mandate of who it covers and who it applies to.
Yeah, so that's really important, is that the company has to be California based. So if your company is based in New York, your company doesn't have to necessarily comply with this law. They may want to, by the way, they may want to. And if your company doesn't, I highly encourage you to talk to your HR and say, this is a benefit that a lot of individuals want. And there's a lot of people in California getting it through their companies. So for your company to stay competitive, they really should have fertility benefits. But again, so it's California-based company, over 100 people. Can you talk a little bit about the other thing about if the company is self-insured or not insured? Because you could have a California-based company and has over 100 and it's still not covered in this plan.
That is correct. The company has to that is fully insured, not self-funded. So that is a big factor as well. So
Mm.
it has to be covered as fully insured.
Okay. So sometimes what that means is that you might have a company that has decided that they are going to pay for all of their insurance benefits, right? That means like a self-funded company, and they're just using one of the insurance providers as what we call a third party, right? To kind of administer the plan, but they're actually covering the cost of it. So it is something, it's nuanced, right?
Yeah, correct. The fully insured is just it's exactly that, right? It's the company purchasing through a health plan, and the health plan is funding it versus a company funding it as a self-funded.
Got it. So can you talk a little bit about what are the services that can be covered?
Yeah, so you have the fertility diagnostic and treatment, so it includes IVF, and then you
Mm-hmm.
completed egg retrievals. You also
Mm-hmm.
have unlimited embryo transfers if medically necessary, and then the fertility medications that I just mentioned a little while ago. So there are some
Mm-hmm.
things covered, and then it all is based on your plan. And so if you have questions on if you are covered or if you have certain services that are covered, it is always best to start with your HR human resources department and contact them
Mm-hmm.
if this plan is covered under the California fertility insurance mandate, but then also reach out to your insurance company as well.
Okay. Yeah, and that's really important, is that I think that sometimes you hear these big names in insurance and you just assume, okay, well, and I'm just going to say some names, I'm not picking on anybody, but like, Blue Cross or Cigna or Aetna, you just assume that everyone who has Aetna or United Healthcare, everyone who has an Aetna plan has the same Aetna plan. And that's actually not true. The employers go to Aetna and they negotiate different health plans and they can carve out things and all that kind of stuff. So you actually have to know your specific insurance plan with your employer.
Yeah, absolutely. Copays. I mean, it gets down to copays, deductibles, all of that could be different as well as
Hmm.
mobility.
But some things like if they fall into this fertility coverage, there are things that have to be covered. So where they don't have the choice, so they don't have the choice to carve it out. Like they can't. So if they fall under this law, they have to cover the diagnostics, they cover the treatment. The treatment does include IVF. Again, you said up to 3 egg retrievals, unlimited embryo transfers as medically necessary. So we also, again, some of this is going to get nuanced and things are going to change over time of like, what does it mean to be medically necessary for a transfer? So we're going to, that we have to just see fertility medications and also storage, right? So like if you have embryos that are stored, I think it's like up to the first 5 years, something like that is covered.
Correct. It is the first 5 years of storage coverage,
Mm-hmm.
covered
Mm-hmm.
for storage. So yeah, for 5 years.
And then can you explain a little bit about, just so patients know, like what a prior auth is? Because sometimes the insurance will require a prior auth and sometimes it won't. How that impacts them in their cycles in terms of timing?
Absolutely. So a prior authorization is something that or the health plan will require in order to continue with services or even medication and orders of medication through the pharmacy. And how
Mhm.
that delay is if we are waiting on the payer for the health prior authorization. Sometimes that can take some time to go through and process, but also just understanding kind of what that treatment plan is as well for that patient that's been outlined. That helps us kind of work proactively in getting that prior authorization and making sure there is no delay.
Yeah, it's super important to like communicate with your physician as a patient, like, okay, we've made this decision. We want to do IVF, for example, because we have to put in a very specific authorization for that type of treatment. We are saying we are doing an IVF procedure or we're doing a frozen embryo transfer procedure. And so it's not like we're just getting authorization for any treatment. It is a very specific thing. And again, it can take, I always tell my patients 15 days, like 15 working days. That's 3 weeks from like the moment we turn in the prior auth before they might get that approval back. Sometimes it's shorter and sometimes that's amazing, especially if it's kind of been pre-approved and it's just lapsed before. But it is hard. And so that's something that we, as providers strive really carefully, and your team does such a good job of understanding who needs a prior auth and who doesn't, because there are certain tests that we have to turn into the insurance for them to approve certain things. And so like we need to make sure we have that. And some of that, for example, for women that are doing IVF often is like on day 3 of your period getting this hormone called FSH. And so if you don't have it, you have to wait for the next day 3. So again, that's incumbent on us, like on our team, to make sure that we know that you need a prior auth and getting those things early, so we're not delaying your treatment. With these prior auths, one thing that I've run into is I do sometimes have patients like want to go straight in immediately into another treatment. They want to do an IVF, have an egg retrieval, and then start a stimulation 5 days later, which is we call oftentimes a duostem. So they're going kind of back to back. And you can't do that if you need a prior auth, because you have to conclude the first cycle, then you can turn in the prior auth for the second one. The other thing that I have come across too is that sometimes if you have a patient who wants to do a transfer and then they change their mind and they now want to do another stimulation to bank more embryos. Again, the authorization is not blanket for anything. Someone had an authorization for a transfer, they didn't have an authorization for an IVF, so you have to turn in a new prior auth. So it's kind of the subtleties, but it's important to, I think, as a patient, it's just important to know, just so that like everyone's on the same page of like what the timing looks for like for the treatment.
Yeah,
And we would love to rush things, but we can't.
and we can check to see if your plan requires a prior auth for certain services.
Mm-hmm.
That at the very beginning during a consultation, we're checking through insurance coverage and looking at those fertility benefits and what's available and what requires a prior
Mm-hmm.
auth. So we're ready for that when, during or after the consultation.
Yeah. Can you talk a little bit about egg freezing? Because I've always had a lot of patients that want to freeze their eggs. It's always been a large part of the services that I've provided. So can you talk a little bit about what is and what is not covered under this bill.
And that's going to be a common misconception, right, under this mandate. So it is the term that we hear is egg freezing is covered, and it is covered if under by certain plans, right? So elective social egg freezing is not going to be covered under this mandate, but there could be coverage for freezing based off your plan and the policy and what your health plan covers.
Yeah. So my understanding, there is some under this mandate for medically indicated egg preservation. And I would love it if that word was really broad and meant a lot of things, where you would have women who have less eggs, and in my mind that's medically indicated that they should be able to freeze eggs, but unfortunately it's not. Most of the time with these insurances, like a medically necessary egg freezing means that someone has cancer and they're going to be getting chemotherapy. And so it is frustrating, right? Because I really, as part of this bill, wanted to be, because it is wonderful. It is so comprehensive, includes all groups in it. But one of the things that it is missing is that it didn't change the fertility preservation. And so it is, again, your specific insurance might opt to cover fertility preservation. Like any company might say, we want to do this. We think this is important. We think it's important for our employees. We think that it will help retain them, and it's just a good thing to do. But some insurances will not, and they don't have to under this mandate.
Yeah, you said it exactly. Like coverage will vary. It varies by employer, it varies by plan, and it's even under a mandate, it's going to vary.
Yeah. And some people, again, it's so important to understand what your benefits are, because you may have one of these major medical plans, right, that in some instances are covering insurance, and covering their insurance is covering fertility. But in other instances, there are a lot of companies in California that provide fertility care. They're just maybe not doing it through their major medical plan. Like there are other companies that do carve outs where they just cover fertility, right? And so your company may have not, maybe they don't have to cover fertility by this benefit, by the mandate, but they are opting because, again, they want to be kind to their employees. They want to provide a benefit to kind of be more competitive with other companies of their same like. And so they're buying these like carved out fertility plans that either will pay for a certain amount of cycles or it's a certain amount of money. And so those are all different, but they're not the mandated, like it's not like with, if you have that type of insurance, you're just really lucky that your employer provides that. And there are a lot of companies in California, but there's a lot of people without coverage. Too many.
There are, I agree. I agree. And hopefully this law will help, kind of close that gap a little bit.
I know. And we're so excited because previously we haven't been enrolled in network with insurance providers at Pinnacle Fertility California, but now we are, which is really incredible. And the team at Pinnacle has been working so hard because it actually takes a lot of work to have a provider kind of become in network with these insurance plans. And so I think we're like 99% of the way there. There was like one that's like still pending, and like it's kind of like an everyday, like any day they tell us it's going to go through. So, but otherwise, we're registered, we're ready to go for like almost everything, which is amazing.
That is so exciting. It was such a good thing to do that right before and get you guys in network right before 1/1/26, so we could make sure that we expanded coverage when this new law and this new mandate hit. We were able to
Hmm.
schedule patients right away because we were already in
Yeah.
coverage network with those
Yeah.
patients. Very exciting.
I know. So, in terms of for a patient, um, I know sometimes people feel comfortable like contacting their own HR to do this. How is Pinnacle, like what are we doing? So like if someone doesn't know and they haven't contacted their HR and they are just calling to make an appointment with me, what are we doing for the patients to help them understand what their benefits are?
Yeah, absolutely. I said it a little bit ago. So we're going to do a full insurance verification for patients,
Okay.
and check, what is their fertility coverage? What is the pharmacy medication coverage? We go through all of that. How many cycles are covered? Is a prior authorization required? We go through all those steps to make sure that the patient is aware of what is covered and what is covered for them in the future, and whether it's a prior authorization. We go through all those steps, and then we connect the patient with one of our financial counselors, and those financial counselors go through details of their benefits.
Okay, so kind of like the same time. So they would meet with their provider first, and then that verification of benefits, that's such a term that we are so familiar with in our world. So the verification of benefits would get done on the back end. And then when the patient would talk to their financial counselor after the appointment, that's when they're going to go through the benefits with them so the patient can understand. So we're kind of pinging the HR. So like if you haven't done it and you have an appointment, you don't have to cancel your appointment if you haven't talked to your HR. Just come in and we'll see you, and then let us kind of find out for you what your benefits are. So you don't have to call and like if you need help, you're going to need help no matter what, right? So the best thing is probably, yes, if you are absolutely curious and it's going to make a difference if when you make your appointment, call your HR and understand. It's always good to have that information, but you don't need to have that information to make your appointment. If you know you want to come in, you know you need to come in, just make an appointment, and then on the back end, we'll take care of everything for you.
Yep, absolutely.
Yeah. Well, we want that. It takes out all the hard work.
Because, we want to is focused on the care that we can provide them and not have to dig through all the healthcare
Yeah.
work. And we want to make sure that we're able to provide that service up front for them.
Yeah, amazing. I know there were a few questions. So someone had asked like what's medically indicated, and I think we covered that already, which unfortunately it's way too narrow. It's very, and I've had patients that are like, can you please like write a letter? I'm like, I'll write a letter, but like I've never had an insurance kind of overwrite it before. And they're very, very strict in what they cover with what's medically indicated, even though as a physician, I feel like there are things that make this medically indicated. They have a very narrow definition of what that means. And someone else asked about what states cover IVF. And there are some states that cover a lot. Illinois is one, Massachusetts is another one. So there are mandates in those states. The Illinois one is actually really amazing. It's like multiple IVF cycles and it restarts every year. So it goes for a long time. So the Illinois one's really amazing. But it does depend on where you live, and all the rules are a little bit different. So again, wherever you are, it's just important to understand because again, some of it, like the California one, it's where your company is based. It's
Right.
not like, are you living in California?
Yeah, correct. And not all the states have that as part of their mandate. The mandated states that may not be included, that they have to have an employer that's based in Illinois, right? So,
Yeah. Yeah.
and so it really does depend on where you are located.
Yeah. Amazing. Well, I think we covered a lot, but I, but I think the most important thing is just getting information. And I always have felt that way about fertility. It's just the more information you have, the better. So the more information you have about learning about your own body, talking to someone, and even starting to think about like what you want for the future, how many kids you want, how old you want to be, that whole picture is so incredibly important. And now we incorporate, all right, do you have fertility coverage? And how might that change your approach to what you're doing? And so I always say it's never too early to see a fertility specialist, because I really view my job as so much as just education, right? And teaching someone. If I have someone and they come in and they're not ready, but I've given them peace of mind in terms of trying on their own, and they feel that they've learned a lot from talking to me, and maybe we have even optimized their chances of getting pregnant. That's so important important. So, please just don't hesitate, especially if if someone thinks that they might have an issue that might kind of be interfering with their fertility. It's just important to see someone early.
Yeah, agreed. I agree with that. That's great
Yeah.
information.
Yeah. And so, I just want to say to you, thank you so much for everything that you have done for us and to get us started here at Pinnacle Fertility in California, to get us started on um, uh, with our insurance patients and get us onboarded and have everything. We just want to, it's so important to us to make sure the patient experience is smooth. It's hard enough going through some of these treatments. It's hard enough suffering from infertility or recurrent pregnancy loss. And it's so important to like make the process, at least for the patient, as frictionless as possible. And so really that's a credit to you and your team. So thank you.
It was our pleasure. It was just as exciting for us as it is for the clinic and the patients. It
Yeah.
was a win for us too. It was exciting to deliver that communication to the clinic.
Yeah.
That work, and you're welcome. But it
Awesome. All right. Well, thank you everybody for tuning in. If you have any further questions, please don't hesitate. Please reach out to us on direct message, and then we can get those questions answered for you.
thank you.
All right. Bye.